Hi everyone. I'm going to do chapter 10 via a video. I'm not very good at this, so just bear with me. I I'm not going to be available Wednesday, Thursday, and Friday, and with your exam on Monday, I'm going to only be able to make Slidell and Pearl River on Tuesday. And so Wednesday, Thursday, and Friday, I'm going to be tied up with North Shore Tech. So anyway, we're going to start this chapter 10 and let's see how far you get this week. And then if I can continue it next Monday, and hopefully we'll be on a decent schedule again after all this weather and everything. So anyway, chapter 10 is the urinary system. And I'm going to start this before the endocrine system because this is going to give you a nice base for starting the endocrine system, because the endocrine system also includes the urinary system. So I want us to start with how important is this urinary system, and it filters and it excretes waste products. So it's almost like, it sounds like the digestive system. But the urinary system reabsorbs everything, and then puts out the nourishment, the electrolytes, the water, everything, and then it excretes the urine from the body. So it reabsorbs. And you said, well, it reabsorbs. It absorbs. No, the digestive system absorbs when we're eating, okay? And so it goes through all of its with getting rid of the waste, and also puts back the nutrients into our body that we need. So that's absorbed. So that's the first stage. The urinary system then reabsorbs all of that through the kidneys. So the system not only filters and excretes it, it regulates our blood pressure and maintains the fluid, the water, and the electrolytes, which are sodium and potassium, calcium and magnesium. The key organs, I should say, are the kidneys. Yeah, the system consists of the kidneys, the ureters, the bladder, and the urethra. But the kidneys all contain the filtering system, and then the filtering system gets sends back the electrolytes and the water, and then excretes it as urine, as waste. So we're going to find out some terms first, okay? So the kidneys, they're the key organs of the urinary system. And the location is the retroperitoneal space. So peritoneal is the abdominal cavity, which includes the stomach, the intestines, the bladder, all of that area, okay? But retro means in back. So the kidneys go in the back. The electrolytes are the four important electrolytes that our bodies have to keep it in homeostasis is sodium, potassium, magnesium, and calcium. And this is all filtered through the kidneys. Part of this, the filtration system in the kidneys, it's called the nephrons, and we have over 1 million in each kidney. So the filtrate, there's a term called filtrate, and it's the fluid that has been filtered by the walls of the glomerulus and the Bowman's capsule, which permit filtration of the water, electrolytes, urea is a waste product, and other small molecules. So we're going to go through the anatomy of the kidney and that filtration system, the nephron, And so that's in the slide 6, I believe it is. But we've talked about the pH before. Now, a pH spectrum is like 0 to 14. Our blood pH is 7.35 to 7.45. 7.35 and below is acidic. 7.45 is alkaline, and above that it's alkaline and base. Okay, so alkaline and base are synonymous. So anything below 7.35 is going to be acidic. So just keep that in mind, okay? Let me get back to the right page. I'm sorry. There. So the pH scale, we said was 0 to 14. Okay, so the blood pH is 7.34 to 7.45. Very narrow window there. But the urine pH is 4.6 to 8.0. So you've got the 4.6 that is, it's below that would be acidic, and above that would be alkaline or base. So keep those in mind, how different that is, okay? You see how the blood pH has a narrower window than the urine pH. So the urinary system, like I said, consists of the kidneys, the ureters, the bladder, and the urethra. Now, the other term that you see on here is micturition reflex, and this is that urge that you have to urinate or void. Micturition is the process of urinating or void. Okay, so there's 3 terms that mean that you're going to empty your bladder. Okay, now we all most of us all use, oh, I gotta pee. Okay, but during this class, I want you to get used to these terms, because sometimes there's people that you don't know, and they get offended if you say, oh, he's gone to pee. No, that's, you need to say, oh, he's gone to the bathroom, or he's gone to urinate or void. Use the proper terms, not the slang, unless you know the people. In this, in the kidney, in the urinary system, we've got diseases of the kidney. Okay, so most of the time you can have a kidney infection, which is not the same as a bladder infection. Kidney infections can be caused from bacteria. That can be caused, a kidney can be damaged from medication. It can be damaged by blood pressure and diabetes. So it's pretty serious when your kidneys are damaged. And the people that have are in renal failure, like this term, or end-stage renal disease, ESRD. This can be caused from high blood pressure or diabetes. And when someone's in renal failure or end-stage renal disease, the worst case scenario is that they have to be on dialysis for the rest of their life. And there's 2 types of dialysis, and we'll see this in the terms: hemodialysis and peritoneal dialysis. The hemodialysis is the most common, and it's got these people have a fistula in their forearm, and if you put your hand over that fistula, you can feel the pulsating. And this is where the dialysis needle goes in, and then they have dialysis through this needle and this fistula, and it's 4 hours, 3 times a week for the rest of their lives. Then there's that peritoneal dialysis that the person can do it at home while they sleep, and they connect themselves to the needle goes into the abdominal wall, and then it stays there till they wake up in the morning, and then they disconnect, and then they go about their daily lives. And that seems so much easier, but not everybody is a candidate for that. If you've had abdominal surgery, scar tissue builds up in there, and this keeps you from having the peritoneal dialysis. So on this slide, you've got what I just talked about, hemodialysis and peritoneal dialysis. Then you've got urinary incontinence. Urinary incontinence is when you're not able to hold the urine inside and it comes out. Now, many women, elderly women who have had babies years before, their pelvic muscles get very lax, I want to say, and it's not able to hold the bladder up, and then the bladder drops, and then the urine comes really quick. Sometimes when they sneeze or they run or anything like that. So sometimes surgery helps that, and they have many other types of treatment for that also. Now, sometimes you will have incontinence from a stroke, where the stroke has affected the nerves down in the bladder, like, below the waist or something, or a spinal cord injury or something like that. But then I want to tell you about this stress incontinence. That's when they cough. When someone coughs or sneezes, or they're lifting something heavy, a little bit of urine comes out. That is called stress incontinence. All right, now let's talk about this kidney. You see how the kidney is shaped? It looks like a kidney bean that we put in chili, right? That's why the kidney beans are named that. So on your kidney is about your hand size. And the outside of the kidney is called the capsule. Okay, so the capsule protects the inside of the kidney and it keeps its shape. Then if you look on right in here, you see this is called the renal cortex. And these little hair-like things in there, it looks like, these are called nephrons. Now, the nephron is the filtration system of the kidney. So the nephron is in this cortex, and then it comes down into the medulla. Now, these medulla are pyramid shaped, and they see these lines here? This is the nephron also. So the nephron is part of the cortex and then part of the medulla. And what happens is, see this red? This is the renal artery, and then this is the renal vein. So you've got the renal artery that is bringing blood in from the heart, and it goes into the kidney. So remember how arteries go down into smaller arteries called arterioles? So you've got a renal arteriole. Now, if you look up at this upper diagram, here's your renal artery and now the arteriole. Now it goes up and into this ball. This ball here is called Bowman's capsule. And inside Bowman's capsule is the glomerulus. Okay, I'm sorry, glomerulus. And so this is bringing blood up to the glomerulus. This is called afferent arteriole. Afferent means it's bringing it to it. Okay, it's bringing the blood to that Bowman's capsule. And the blood's going to get filtered through here. And the glomerulus looks like a wadded up ball of yarn is what it looks like. So then It's going through the filtration, and then it's going to go through the efferent. Efferent means away. So the efferent arteriole, and it's going to go into the proximal tubules. So this is going to wind all around here, and it's going to go down into this loop. And this loop is called the loop of Henle, or Henle loop. And you've got a lot of reabsorption going on in there of the electrolytes. So on one side it's absorbing, and the other one it's excreting. So then it comes up through all this filtering, and then it comes through this thing, and this looks like a tree branch. So you've got these little branches off here, and this is where the nutrients come out. But on down, if you follow this, this is where the urine, the waste is the urine, comes out here and goes into the ureter. Now over here in the kidney, all of this is taking place up here in this cortex and the medulla, okay? So then it comes down into the calces minor and major, and then see this white part here? That's the renal pelvis. And from the renal pelvis, this is where the urine collects. It then comes out here into the ureter, and then goes down to the bladder, and then out the urethra. So that's the dynamics of the kidney and the filtration system. And here you can see in the female anatomy, you've got here's the aorta, and then this branches off into the femoral arteries here. And then up here, this is where the renal artery goes into the kidney. And then these little tubes, those are the ureters, okay? Comes down to the bladder. In the male physiology, the thing that's different here is, number one, the urethra is longer. And number two, in the urethra, up here by the bladder, is the prostate gland. And whereas women have this incontinence issue when they get older, men have an enlarged prostate. A lot of them do. And it's benign. It's called the benign prostate hyperplasia, BPH. And this prostate enlarges and it tightens around. The prostate has lobes. And so, when it gets large, it tightens around that urethra, and then the man can't empty his bladder all at once. So he has to go to the bathroom frequency, and it's just like little spurts. On your combining forms, I want you to pay attention to what some of them just don't make sense. And the first one, that azote, that does not make sense to me. It's nitrogen. And so nitrogen is a waste in the urine. Okay, that comes out in the urine. It means that your kidneys are getting rid of that waste. I remember I was taking organic chemistry years ago, and I think nitrogen, it's a bluish color when you're mixing it, I think. I'm not quite sure on that. That's been a long time ago. But you've got bacteria. Now, bacteria when you have a urinary tract infection, a UTI, that's usually bacteria. The most common bacteria that is in the bladder is E. coli. Now, we find E. coli in the colon. That is where it's supposed to be. You don't get sick from E. coli in your colon. But when it comes out and goes elsewhere, it makes you sick. So what happens is, like when we're potty training a kid, and we tell them, okay, now learn how to wipe, you have to wipe from the front to the back, because if you wipe from the back to the front, you're going to bring that E. coli up into the bladder and up by their urethra, and then that bacteria is going to go right up in the bladder. This happens so much. They'll do a urinalysis, a UA, and they will say, oh, it's E. coli. So that means that bacteria from the colon has gone up into the bladder. So bladder and kidney function are not the same. People call it the same, and it's not the same. Bladder infection's in the bladder, but when it starts going up the ureter to the kidneys, it goes into a kidney infection. Glyc and gluc are that is sugar, okay? The same as sugar. So look at your terms on that. Ketones. Ketone is a waste product. If they find it in the urine, it's a sign of diabetes. This next combining form is lith. Always remember that is stones. In this, you have kidney stones, and they come down the ureter and they drop into the bladder. Now, people can have stones in their bladder and forever. As long as they don't move, it's fine. As they don't block the urethra opening, that, they're fine. But once it starts moving, it's very painful. So a kidney stone is nephrolithiasis. A lot easier to say kidney stone, isn't it? When they have this, and we'll talk about in procedures in just a few minutes, but the procedure to get rid of kidney stones is not the same that it could get rid of gallstones, okay? Only the kidney stones. Meat, or this is supposed to be meate, okay? So meatus. Meatus is an opening. So at the end of the urethra, there is a meatus, and it's the opening, okay? Anything nephro is kidney. Noct is nighttime. So nocturia is another name for bedwetting. Not necessarily, though. It can be bedwetting, but it's urinating all night long. So like some men who have that BPH, they have to get up frequently to the bathroom and go to urinate. Women with the bladder dropping down, they have to go urinate all night long too. Oliguria is also, you call that, the BPH can cause that because it's they're not urinating correctly, okay? Peritone, that is the pertaining to the peritoneum, okay? Pie, that is pus. Pyuria is pus in the urine. Pile is the renal pelvis. And so when you look at this, I've got a word down here, pyelonephritis. That is the renal pelvis. Okay, that's an infection in the kidney in the renal pelvis. Ren is also for renal, so kidney. So you've got ren and you've got neph. This vesic down here, that is a weakened area, can be a vesicocele, that's a hernia, okay? That's a weakened area. So I've got a sentence here. Joe noticed a lump at the bladder area, and Dr. Sisto diagnosed it as a vesicele. So that was a hernia. I think that got switched. I'll get that moved. Okay, so pathologies. Acute glomu, glomu, I can't say it, nephritis is a type of kidney infection. The glomeruli are inside the Bowman's capsule, also called acute nephrotic syndrome. Pink or cola-colored urine, foamy or bubbly urine due to excess protein, hypertension, fluid retention in the face, hands and feet, and abdomen, urinating less, and nausea and vomiting. Bacterial cystitis, inflammation of the bladder caused by bacteria in the bladder. So this is called the UTI, and you're going to have burning. You'll have frequency, cloudy, red. It could be bloody. So, and it's strong, and your lower pelvis does hurt. Diabetic neuropathy is the kidney disease from diabetes, and this results in inflammation, degeneration of the kidney, and sclerosis. Diuresis, abnormal large amounts of urine. This is from medication. You're given medication like Lasix if the person is holding in water or their blood pressure is high, they're going to give them Lasix usually, and so they're going to urinate quite a lot. If they're in the hospital will usually put a Foley catheter in them so they can monitor the output. So they want to do an I&O, and that's input and output. So they're going to watch how much the patient is taking in and then how much he's putting out, because he should be putting out what he's putting in, okay? End-stage renal disease, we've got lots of abbreviations, so just remember that ESRD, that's end-stage renal disease, this is final phase. Anything end-stage is final phase, and this is kidney disease, and they're usually on dialysis. Enuresis, this is the bedwetting. It's involuntary, it's incontinence, urination during sleep, bedwetting. Children, they're so embarrassed. Some of them, they're potty trained, but at night they have accidents when they're sleeping. And sometimes this is from their bladders being too small. And the bladders will grow with them, but sometimes the bladders are a little slower at growing, and they're not able to hold the urine. And this is what causes a bedwetting. Hydronephrosis, caused by urine obstruction. Urine backs up and the renal pelvis and the calces become distended and atrophied. The kidney swells. So if for some reason there's a blockage, it could be from at the ureter, blocking the down at the bladder, and then the urine isn't able to go down in the bladder, so it's going to back up to the kidney, and then the kidney swells up. Not good. Interstitial cystitis, very painful. Chronic inflammation of the bladder lining. This is it usually is caused by a lot of acidic stuff like food, drinks, coffee, chocolate. You really have to watch what you're drinking and eating. And it's painful, very painful. Interstitial nephritis is pathological changes in the renal tissue that destroy nephrons and impair the kidney function. Once you start destroying these nephrons, your kidney function is going down. There's no other way. Nephrotic syndrome, uncommon disorder marked by massive proteinuria, so protein in the urine, edema, hypoalbuminemia, hyperlipidemia, and hypercoagulability. Neurogenic bladder is a dysfunctional bladder from injury like spinal cord injury, a stroke, some sort of disease. So, and it's sad. Phimosis is a narrowing or stricture of the foreskin of uncircumcised infant opening of the penis. So they have to open that up either surgically, it's the only thing I can think of, or circumcise the baby. Polycystic kidney disease, hereditary disease, and it's sad. It really is, progressive, which cysts form in the kidneys, causing the kidneys to enlarge and lose function over time and destroy them. Other pathology, pyelonephritis, inflammation and infection caused by bacterial growth in the renal pelvis. Renal calculus, another name for a kidney stone. Renal colic, this is all in the renal pelvis now. Okay, small kidneys, severe intermittent pain caused by spasms of the ureter. Renal failure, acute or chronic, and usually caused by hypertension and diabetes. Renal colic, let me go back here, severe intermittent pain caused by spasms of the ureter. So this could be renal, it's not the renal pelvis, it's the, because that's pile, remember? So renal colic, spasms of the ureter, that could be from a stone maybe. Because that happens. Tubular necrosis, renal failure caused by acute injury to the renal tubules. Most frequent cause are CVA or MI, which reduce oxygen to the kidneys. Also, X-ray contrast dye. When they do X-rays that they inject dye, they are supposed to look for kidney function. Make sure that your kidney functions are normal. If they aren't, if they are already not functioning well, that dye can ruin the kidneys. Uremia, increased level of urea and other waste in the blood. Urea is a waste product, don't forget. Urgency is that need to urinate, that micturition reflex. Urinary incontinence, that's what we said, is involuntary. Urinary retention, unable to urinate. I had a girl come into a doctor's office where I worked one time, and she said she hadn't been able to urinate, and when we checked her out, her bladder was all the way up to her belly button. Your bladder should only be down there in that lower part of your pelvis. This was already up to her belly button, and she looked like she was a few months pregnant. When we put a catheter in her, a Foley catheter in her, we got so much urine out, but we had to send her to the hospital, find out what was going on. Vesicoureteral reflux, abnormal flow of urine from the bladder back into the ureter, usually found when an infant or young child is diagnosed with a UTI. Well, that's pretty bad. Wilms tumor, most common type, rapid growing tumor, commonly in children, and is a type of kidney cancer. Other name, nephroblastoma, or malignant neoplasm of kidneys. Ages usually 3 to 4 years of age, and much less common after 5 years of age. Now let's get to abbreviations. Get with these abbreviations so that you know them. These are the real common ones are the chronic renal failure. I don't see VCUG very often. Voiding, cystourethography. And there's going to be I think there's an X-ray in one of the slides that's coming up. UA is urinalysis. IVP is intravenous pyelogram, and that's where they're going to put dye, and they inject dye into your vein, and they have you drink a lot of water to fill the bladder up, and you can't urinate. You got to hold it, and it's very uncomfortable. And so then when they inject the dye, they look at all the kidneys, they look at the ureters and all that to make sure if you've got any stones in there or whatever, okay? So IVP. ARF is acute renal failure. HD is hemodialysis. Here's your PKD, the polycystic kidney disease, that's hereditary. BPH, benign prostate hyperplasia, the enlarged prostate. ESRD, end-stage renal disease. AGN, acute glomerulonephritis. I can't say that word for anything. INO, input and output, very important to know. This is where you're going to have to measure how much you're taking in and how much you're urinating out. Specific gravity, this is to show the acidity, really, of the urine, and how concentrated it is or not concentrated. So if somebody is dehydrated, the urine is going to be very, very dark and usually has an odor to it. If they're not, if they're well hydrated or maybe too much, the urine is going to be like water. And I've seen people that were like waterholics, that they drank so much water that their system was oversaturated with water. Cath is catheterization. BNO, bladder neck obstruction. UTI is important, urinary tract infection. BUN is a blood urea nitrogen blood test that they check for kidney function. And ATN, acute tubular, I don't see this very often, acute tubular necrosis. So your test that we have, the common diagnostic tests and procedures, culture and sensitivity. If it shows that you've got a urinary tract infection, a UTI, they will do a culture and sensitivity. They want to see what kind of bacteria it is and then what antibiotic to put you on. So the sensitivity is which antibiotic is going to kill that bacteria. It comes up sensitive and resistant. So it tells the doctor, well, it's sensitive to amoxicillin, but it's resistant to, let's say, vancomycin, okay? So it tells you what medications that they can take to kill the bacteria. A cystoscopy is a scope that the urologist uses to go up into the urethra, up into the bladder, to look at the bladder. And so they will do biopsies. They can see if there's any stones in there, whatever. So cystoscopy, and it's usually an outpatient procedure. It's nothing big, and you're usually asleep. 24-hour urine specimen is, they collect urine over 24 hours. So they have to measure it and be precise on it and then put it in the refrigerator so bacteria doesn't grow in it. So when they empty it out of the bag or the pilgrim hat, they have to measure it, write it down, the time and everything, and then put what they've measured, put it in the refrigerator. So then the bladder ultrasound or the bladder scanner is really kind of cool. They somebody that's had a Foley catheter in their bladder and they remove it, the doctor says after they void on their own, then use the bladder scanner to see if they were able to empty their bladder. Because if they don't empty their bladder, bacteria can grow in there and cause a urinary tract infection. So they need to find out what the problem is, okay? But anyway, the bladder, you can see the urine in there if they have not emptied their bladder. Blood urea nitrogen is the waste products. This is a blood test to check out the kidney function. This is KUB. The doctor will order a KUB x-ray. And so that's kidneys, ureter, and bladder. So this is all that one section from the kidney area, like around the ribs, down. And you can see how this picture is. And it will show if there's a stone in there, if there's any tumor in there or something, okay? But KUB is kidney, ureter, and bladder. Then you've got this, the lithotripsy. the extracorporeal shock wave lithotripsy. This is the ESWL. This is for kidney stones only. The lithotripsy cannot take care of gallstones. That has to be taken out surgically. So, because it's a different makeup of stones. But the lithotripsy is for kidney stones, and they put the patient on this table on the back, and they're in a supine, and they call it the thumper. It's underneath this table, and it's round, and it comes up and it hits them on the back like that. And they do get bruised sometimes, and so you have to watch out for bleeding when they come back. But so what it's doing is breaking up those stones. So then when the patient comes back to the room, they have to use this, it looks like a little coffee strainer, and they have to strain their urine and catch these little bits of stone that the machine has broken up, and then they send it to the lab. Hemodialysis, that's the dialysis, IVP. I told you it was where they inject dye. And this is a picture of your hemodialysis and the peritoneal. So the shunt is right here, and then here's this. The tubing goes into the abdomen on this one. Serum creatinine is another kidney function, and it's probably a little bit more specific than the BUN. And it's just another way of measuring the kidney function. And there's the EGFR, which for some reason this has not mentioned it. Urinary catheterization, the catheter goes up into the urethra, and then a balloon is inflated in there to hold in that catheter. And then here's this VCUG. I have never seen this done. A radiological examination of the bladder and urethra during urination. And I haven't figured that one out yet. So anyway, that is the end of the PowerPoint. We will be going over this if I get to come back the following week, which I probably will if weather permits and everything. But if you have any questions, please ask, okay? And I hope this helps. And thank you for being patient with me. This is totally different for me to do a video. But thank you, and I will be talking to you soon, okay?